I'm going to perform sternal restraint. I'll be performing lateral restraint. I'll be performing dorsal restraint. For dorsal restraint, you will need two people. One person to hold the legs like this and have your arms and elbows next to the head and the neck to keep them in the right position. And then another person to stretch out the back legs so that they can get a better x-ray of the medial. I will be performing floor restraints. When doing floor restraints, you always want to make sure that you have a leash on them, but you would not tie them to the wall just for safety precautions. You'll also want to have one knee up at all times so you can get away if needed. I'm going to do the corner restraint, which is keeping them in the corner and making sure that they don't escape. I'll be showing you where the venipuncture sites are on a dog. The first one is jugular, which is here. And then there is cephalic, which is here. And then there's lateral saphenous, which is here. And then there's medial saphenous, which is on the inside of the leg. I will be covering restraint with a cat on an exam table, while also covering everything that is listed in that video. A few things that you need to watch out for are the calls and the mouth. A few of the signs that tell you how much restraint will be needed is first observe the cat's eyes and ears. Ears pulled back indicates a defensive posture. Caution should be used even if a cat is not looking at you. Dilated pupils also show how the cat is feeling. Body conformation, hair coat, tail movement, opening mouth, and hissing is a direct sign of aggression and that a lot of restraint might be needed. Handling good-natured cats. Most cats that are used to being handled are more comfortable if they are picked up with one hand under their chest and the other hand supporting their back end as observed. Important to remember, even with sweet, gentle cats, is to gain control of their front legs right away after picking them up. This is done by securing the front legs with your index finger between the cat's legs. Most cats can be kept in place by simply stroking their coat or rubbing them under their chin or behind their ears. If a cat appears to be attempting to bite or scratch, a towel is a very helpful tool in minimizing the biting and scratching. The towel should be doubled over once or sometimes twice to provide sufficient thickness to prevent injury. The towel serves to take away the cat's ability to see and predict your next move. If the cat is going to be placed on the exam table, you often leave the towel loosely draped over the cat to minimize the fear activities it may observe. By controlling the head and neck through the towel, it becomes possible to raise the towel enough to examine the back end of the cat or slip vaccinations or other injections into the cat. The towel can also be used to form what is called a kitty burrito. The kitty burrito, you would start with a towel spread out on the table, bring the front end of the towel into the neck, tuck in the paws, fold one side of the towel, then the back end of the towel, then the other side of the towel. This allows good control of the head. The kitty burrito is also most useful for cats that are not very cooperative, who often try to scratch or bite. Another technique, the first is used when a minimal response is expected, but then the cat must be controlled well enough to get upset and head for the door. You can generally rub behind the ears firmly enough to stabilize the cat's head. This works well with most cats when receiving an injection. Another technique used involves controlling the head by scruffing the neck, scruff snugly behind the ears. When this is not enough and the cat is still resisting and attempting to scratch you, you should resort to a stretch hold. This cat stretch hold is an excellent technique for immobilizing a cat, but most owners would be concerned that their cat might be in pain in this hold. For this reason, you should never restrain a cat in the cat stretch hold in front of the owners. With the right hand, you can get a good hold of the scruff, and with the left hand, secure the back legs in the hocks. It helps to keep your index finger between the back legs. Another hold that we do often is we hold for the cephalic venipuncture, which is useful for blood collection, venous injection, and placement of an IV catheter. The handler should be on the opposite side of the patient from the vein being used. You would want the cat laying on a sternal position or sitting in a sternal position. Then you want to control the head with one hand, and then with the other hand behind the elbow to extend the cat's arm out and roll off the vein. Another hold that we do often is a hold for the jugular, which provides for a good blood draw and preserves the cephalic vein for IV catheter uses. For jugular, the cat should be in a sternal position to be able to see the jugular better. The handler should have one hand controlling the head and jaw, and then the other hand between the legs, stretching them out on the table. This is performed on the edge of the table so you can properly stretch them. I will be performing how to properly do a cat stretch on a feline. First, you want to scruff them and make sure that you have a strong scruff, and then you want to grab between their back legs with your index finger, and then you're going to want to stretch them and hold. The more that you stretch them, the better that the restraint will be. You also want to make sure that your arm is supporting their back so that they don't get injured in the process. Today I will be properly performing how to do a cat burrito. First, you want to get them at the edge of the towel or blanket. Then you want to tuck it in close to their neck. Then you want to wrap it. Make sure that it's tight. You're going to wrap it like that. Then you're going to tuck the back part of the towel. And then you're going to tuck the other part. Some cats will let you just pet them and restrain them for simple annual exams by just like stroking them and petting their coat or rubbing their chin, just to distract them so that they can get the annual exams done. Sometimes that they will even let you use this amount of restraint for vaccines depending on the temperament of the feline. When restraining a dog on an exam table, there's a few factors that come into play. Remember that if performing restraint on a temperament dog, you want to try and use the least amount of restraint possible in the situation. The handler will stand on the opposite side of the dog from the person performing the procedure. First, you will gain control of the dog's head with one arm. You will do this by cradling its head in your arm. You want to leave some room in the crook of your elbow so that you don't apply any pressure to the trachea. You will also want to hold up high enough on the head behind the ears to ensure you have full control of the head. If it was a very small dog, you might be able to use your hand behind the base of their jaw and at the base of the skull to control the head. With your other arm, you will slide it underneath the abdomen to support the back end of the dog and in front of the flank. Supporting the abdomen is especially crucial when performing any procedure to the tail end of the dog. I will be performing restraint on the exam table with a canine. First, you want to make sure that you have good control of the head and the neck. You want to leave a little bit of room in your elbow so you don't squeeze the trachea. You also want to make sure that you have good restraint on the abdomen. I will be demonstrating safe handling of avians. First, you want to observe them from afar and conversate with them so you can get a better understanding of the bird's behavior and attitude. When approaching a bird, you want to start off at their enclosure or cage. Before opening the enclosure, you want to make sure all doors and exits are closed. You do this to make sure that the bird cannot escape if they escape their enclosure and decide to fly around. Most birds are more comfortable being picked up with your left hand, but some birds don't mind. When opening the cage, you should only open it wide enough for your hand to fit in. Then you should grab the bird by giving them your left hand, and you'll slowly lift them out. You can open the cage more when you actually have a hand on the bird. When using a lift table with canines, there's a few things that are important to remember. First, you always want to make sure you have good control of the head. Be careful to never choke a dog with its leash. Before lifting, gain the dog's trust by getting down on the dog's level, slowly offering your hand for the dog to smell. Slowly speak to the dog in a gentle, friendly tone. Gently pet the dog to relax them if able. If shown signs of aggression, consider using a muzzle. Attempt to lift the dog up. If the dog is larger, you will need assistance, but if the dog is a smaller dog, you will use one hand to control the head and the other to control the body close to your chest. If you can, allow the dog to walk onto the table. Elevate the table at a comfortable height. Always have both hands on the dog, which prevents the dog from falling or jumping off. And make sure that you have a hand on the table to prevent it from shaking.
I'll be performing at the lift table. First, you want to get down on the nose level and get in that dress before you proceed. Then you want to make sure that your lift table is all the way to the ground. Since I do that, I'll be lifting the dog up. Then you want to make sure that you have good control of the head and the body, and you want to make sure that you have both hands on the dog at all times, and if possible, a hand on the table to prevent it from shaking.